Hey, this is Jacqueline from Lichen Sclerosus Support Network, where our mission is to empower people with lichen sclerosus by providing evidence based education and support so that we can live in a world where those affected by lichen sclerosus are empowered, educated, and get diagnosed early. If you find the information in these videos helpful, please consider donating your time or money to LSSN so that we can continue with our LS education and support efforts. Now, today we are joined by the esteemed Dr. Rachel Rubin, and we are going to be talking all about vulvar lichen sclerosus and urethral health. We know this is a topic that has a lot of comments and questions and concerns in the LS community. So we thought, let's bring in the expert to share everything you need to know about urethral health and vulvar lichen sclerosus. Now, for folks who are unfamiliar with Dr. Rachel Rubin, she is a board certified urologist and sexual medicine specialist. She is one of only a handful of physicians with fellowship training in sexual medicine for all genders. Dr. Rubin is a clinician, researcher, passionate educator, and she's also incredibly passionate about educating the world at large about the clitoris, which we are here for 100%. In addition to being the former education chair and director at large for ISSWSH, which is the International Society for the Study of Women's Sexual Health, she is also associate editor for the Journal of Sexual Medicine Reviews. Dr. Rubin completed her medical training at Tufts University, her urology training at Georgetown University, and her fellowship in sexual medicine with Dr. Irwin Goldstein in San Diego. Now, I am so pumped for this conversation. I hope you are too. If you like this video, please leave us a thumbs up. And if you want more content like this, be sure to subscribe to our channel so you don't miss on any new LS content that we bring to you. And with that, let's dive into our conversation. All right. So, hello, everyone, and welcome, Dr. Rachel Rubin. It's an honor to have you here with us today. I've been so excited to have this conversation with you. I know it's a conversation that the LS community is really excited to hear and learn more about. So, I've already kind of introduced you, but I always like to have a little bit more of an informal discussion to get to know people a little bit better. So, I have a couple questions before we dive into the LS discussion. And that would be, one thing that I'm always curious to know is how you ended up where you are. Because I always say, as little kids, like, what do you want to be when you're older? We say like astronaut, marine biologist. Who says like sexual medicine,
I always joke, right? The little girl who dreamed of being a penis doctor. I don't know, you always wonder, how did I get here? What weird things in my life had to happen? And what's really interesting, Jacqueline, is when I look back, my friends in middle school, high school, who are still, of course, my friends today, we talked about stuff. We talked about, and we didn't all, like many of us had problems. And so there were issues, there were vulvar issues, there were penis issues, there were all these issues, but it was something that the boys, the girls, we just talked about like it was regular conversations, and it was super easy for us to talk about it. And I don't know what that magic was and why that was. And then when I went out into the real world, I discovered that it really wasn't easy for people to talk about, and that there was a lot of, and so I sort of found my superpower weirdly, right, in this middle school, high school space, and then really dived into it and went into wanting to take care of everybody. Being a urologist, I am not trained just to take care of one gender. And so really being able to dive deeply into sort of sexual health issues for everybody. And it has been just the dream of a lifetime, to be honest.
Yeah. And I'm so grateful that you ended up in this space. And I'm sitting there like thinking about middle school me. Dear Lord, first of all, not using the proper anatomical terms, that's for sure. Not having real conversations about genitals and sex, very superficial, like we had sex and it was good. That was kind of it, right? Or like bragging about the sex that we had, and that was kind of it. I'm curious to know too, what keeps you in this space? What keeps you motivated? Your passion just shines through in everything you do. So what's underneath that passion?
I think it's the obsession with what I do and how much work we have ahead of us. There is just unlimited work to do in this field of sexual medicine for all genders, really.
Mhm.
And there is I joke, I always say I'm Dr. Rachel Rubin, sex detective, right? Like I am deeply curious about these problems and the unknowns and
Mhm.
really trying to figure out, well, what do we know? What don't we know? Who do we have to get to help us know this? And then how do we advocate about it loudly and educate about it loudly? Because it is wild how little we know. And when you educate a group of people and you realize how, like, these are smart, educated people, they don't know
Yeah.
anything, they know nothing. And
Mhm.
so it gives me such energy to teach people basic facts about their body parts and then really trying to push the field forward to say, how do we do better? How do we not let the next generation suffer? How do we train an entire generation of medical clinicians to like help people not have to suffer and deeply, be affected by different issues.
Yeah, I love that. And I love the work that you're doing for the future generations of, healthcare providers. It's interesting in the LS space. Like a lot of newly diagnosed folks who are actually nurses or working in the medical field, and they are astounded. They're like, how did I never hear about this in medical school? Why did no one teach me about this? How come I was using incorrect anatomical terms? I'm in met to your point about these are educated people, and we've been so let down in a way. There's so much information that was left out of curriculums. I remember going to a pub after, I was in grad school. And we went to a pub, and I'm sitting at a table with a bunch of educated people, myself included. And we'll get to this because it's actually perfect for our conversation. I said to my friend, "Oh yeah, you pee out of your vagina." The look she gave me, she turned. "What did you just say? You pee out of your vagina." She goes, "No, you do not. You pee out of your urethral opening." She then took a napkin that was on the table and drew me kind of vulvar anatomy and showed me the pee comes out of here. This is the vagina. No. And I was like, I'm 31 years old, educated, no clue about my body parts. So thank you for the work that you're doing. One last informal question. What is your go-to karaoke song?
Total Eclipse of the Heart. That's easy.
Oh, great. I love that song. Perfect. Okay. So let's start talking about urethral health and vulvar lichen sclerosus. And I think to do so, we need to start with anatomy. What are we even talking about when we say urethral health? So maybe let's start with, what is the urethra? What's the urethral opening? Where are they located? And what are their main functions?
Yeah. So the best way to describe all of this is understanding that the penis and the vulva are exactly the same thing, like literally exactly the same thing. It's all homologs, with the fancy word for saying exactly the same thing.
Right.
So it's really helpful actually to understand the urethra. In many people understand penises, and hopefully as many of your listeners either have kids who have penises, or partners that have penises, or who friends that have somehow you've maybe seen a
Mhm.
penis before. So you've had the skin on the outside of the penis, and you have the muscles in the penis that give it the erection, right? That gets hard. And then you have a tube that runs underside the penis, which the pee comes out of and the ejaculate comes out of. That's called the urethra. Now it's all covered over with skin, right? In the shaft of
Right.
the penis. So what's really interesting is that the skin of the penis and the tissue of the urethra tube are very, very different. Like, just like
Mm.
the skin on your cheek is very different than the skin on the inside of your cheek, right? It's
Yeah.
completely different type of tissue. And so that urethral tube is a very, very delicate type of tissue that acts very differently than the skin. Excuse me one moment.
No problem.
And so the urethra is sort of this channel with which the urine, comes out of. So remember, I said the genitals in the woman are the same as the genitals in the man. And so what happens is, if I were to cut open that penis tissue and then
Mhm.
dig through the skin and then open, I'd get to that urethral sort of tube. Now,
Right.
women don't have a tube. Their tissue is just open, right? It's just open. And so you've
Mhm.
got the skin of the labia majora, the skin of the labia minora, and then inside that labia minora, it changes from the skin, like the outside of your cheek, to the urethral tissue, which is called the vulvar vestibule, which is like the inside of your mouth, right? That kind of mucosa kind of a feeling. And that is actually urethral bladder tissue. It's called the vulvar vestibule. And when you follow it up, there's a little hole right under the clitoris, sort of between the labia minora. There's a hole, that's the urethral hole opening. And that is then like about a 4-centimeter tube that goes then to your bladder. And so all of that tissue, the urethral tissue, and then the tissue that surrounds the urethra is all made up of that very delicate urethral tissue. And unfortunately, lichen sclerosus can attack so much of this tissue. It can attack the skin on the outside most commonly, and it can attack the urethral tissue as well. Interestingly enough, men also get lichen sclerosus, and they can get really bad scarring throughout the lining of their urethra in their penis, and it can be sort of very devastating. We don't see that as much as in women, surprisingly, which is actually, I find, a fascinating difference between men and women, and something that the research doesn't do enough of looking at, of why men get urethral scarring, inside the tube, and women, I don't see it very often in my clinical practice. Does that make sense? It was sort of like the other important thing is within that tube of both the penis and the opening of the vulva, there are a lot of glands that live and open inside this tissue. So men have little glands that make ejaculate, like pre-ejaculate, we call pre-cum, right? Where it makes a little bit of fluid that sort of lubricates that pipe of the urethra. Well, women have the same glands around the urethra, and they're called periurethral glands or perivestibular glands or Bartholin's glands. And so that kind of lubricates the tissue and lubricates the lining a little bit. And all of these things seem to be very hormonally sensitive. And the research seems to indicate that there's receptors both for estrogen as well as testosterone in this tissue, and that different life changes, either prepubertal or menopausal or breastfeeding or birth control pills or other things, can alter the hormones in your body, which can affect the health of this tissue. And then sometimes when you have a lichen sclerosus patient, you can see flares around various times of the hormonal transition.
Yeah, definitely. That's something that we hear a lot is flaring around certain parts of people's cycles. Postpartum is another thing that can sometimes come up. Is it, you were talking about tracing, you're in that kind of vestibular area and then tracing, and then there's that little hole that's the opening. Is it normal that, or I guess common, that people can't see that? So if I do a vulva check, for instance, and I've got my little mirror propped up, I can't see any opening. I see the vestibule, I see all of that, but
It's
I
even
can't
hard
really
to
see
see.
an
So
opening.
you really have to spread, right? So you take these labia and you have to, like opening up a book, you have to take the labia minora, those inner wings, which many people with lichen sclerosus don't have, and they scar down, but you have to then spread like you're opening a book to then see the urethra and and sort of all the area. And don't be afraid to stretch it open wide like a book, right? To open it. And then it is at the surface, but because the labia are like this, you really have to spread it open like a book.
Oh, interesting. Okay, well, I know what I'm doing for my next vulva check. Actually, I probably won't even wait. I'm just curious. I want to see it.
And it is important, right? Is in order to spread it open so that you can really see all there's a lot of crevices and areas where you can even see the little glands openings. You can see the transition from the skin to that vulvar vestibule urethra tissue, because you see what looks like almost cobbly stone skin, and then you see what is like a really shiny tissue. That's the vulvar vestibule. Similar to, again, you look at your cheek, and it looks different, right, than the inside of your cheek. And so there is a difference in that type of tissue, which is super interesting.
It is, yeah. So let's talk about how can vulvar lichen sclerosus affect this kind of vestibular urethral tissue in terms of symptoms, but also in terms of signs too. So things that we can see, like, can you get the color changes there? Can you get textural changes there? I mean, the tissue, to your point, is different. So can you see similar texture changes there, or is that not so much the case?
Yeah, I tend to see, again, it's really important that we use our eyeballs and that we use our sense of, we see a lot of itching and irritation. So many people, as you hear all the time, are treated for yeast infection after yeast infection after yeast infection, and no one's looking and seeing that there are really significant inflammatory changes sort of and scarring from the lichen sclerosus that's creating this pelvic itch. But again, not everything that itches is yeast, and not everything that itches is lichen. And sometimes itch is a nerve. Like I saw a lady with horrible itching and pain, and we look and everything was perfect, her tissue, but her muscles are super tight. And I said, I think this is a nerve itch, a muscle itch. And so you really have to see someone who has eyeballs that are open, right? I think open eyeballs that are really looking and know how to look, because we are not often trained, and that's why we do a lot of teaching, are not trained as clinicians how to properly look at the vulva. They teach doctors how to look at the cervix. They teach doctors how to look at the urethra. They don't often teach you how to look at the vulvar skin issues. Dermatologists barely know how to look at it, which is infuriating because they look at every other part of the skin. They should be looking at vulvar skin, but often this is sort of what we call a no man's land, where nobody wants to sort of say that this is their thing, which is really a big challenge. And so you can see lichen with your eyeballs if your eyeballs are open. It can look whitish. It can look almost crinkly. It can look dry. It can look like everyone says cigarette paper, which nobody really deals with anymore, but it kind of like that thin tissue feeling. And again, it can really affect sort of the architecture of the vulva and sort of cause some scar tissue at the clitoris and at the labial area. Now, again, sometimes this gets diagnosed when it's not lichen and it's just a hormone change. And so oftentimes it's actually, for many people, it's just a lack of hormones to the area that can cause these problems. And sometimes, often it's both. And that's really important, is I find some mistakes that are made with treatment of lichen sclerosus, where you are just getting steroid treatment and you're not getting hormonal support at the same time. And so if I can give one yelling and screaming thing to all the lichen people listening, first of all, thank you for listening, and thank you for taking your own health into your own hands and advocating for yourselves. If you are only on steroids, considering a topical local hormone like vaginal estrogen or vaginal DHEA can really be life-saving to the health of your tissue and actually help keep your lichen at bay.
On that topic, do you have any recommendations for advocating for vaginal estrogen in folks who are younger? So, for instance, we sometimes hear that there's challenges in people that have lichen sclerosus. Maybe they're in their late 20s. And when you present in your late 20s to your GP or to your gynecologist and you request vaginal estrogen, we're often told, you're too young. You're too young for that. Come back when you're 45.
It's a big
don't even bother.
It's a big problem in the terminology, and we're working on that. It's a slow process. Again, I'm hopeful. The AUA guidelines, the American Urologic Association, is working on guidelines for genitourinary syndrome of menopause. And I'm hopeful some of the language, I don't know what it's going to ultimately say, but I'm hopeful there'll be language to include people who are not menopausal, because it really is the genital and urinary symptoms that happen during hormonal challenges. So whether that's breastfeeding or birth control pills, or when you have lichen, it's hormonal challenges. And so adding local hormones to your tissue has no effect on your ovaries, has no effect on your ovulation, has no effect on getting pregnant. Like it's so safe and non-problematic. And so the answer to your doctor is, why would it harm me, right? It will help me. There's data to show it will help me. There's no data to show it will harm me. This is a $20 tube of cream. Like, this is insane that you wouldn't want to try this, right? And so there is literature, there is research out there of local vaginal hormones, but we as researchers and clinicians need to do a better job of arming you with the tools to say, you're actually wrong here. You actually don't understand this. And this is why hormones are important. But I'll tell you, there is a big challenge, because a lot of the lichen research is done by dermatologists who don't play with hormones. And so there is a big gap in us convincing the ISSVD and all of these, and all of these non-hormone treating doctors, how much there's a hormonal component here, and knowing that it is in their lane. Like, a dermatologist should be prescribing vaginal hormones, like absolutely should be prescribing vaginal hormones, and them not doing that is a big problem.
Yeah, no, I 100% agree. My approach is typically, I know a lot of doctors are kind of evidence and data driven. So I usually come in with my request. I want vaginal estrogen. Here is why. X symptoms, X difficulties, and here's the literature supporting my request. So I'm not just coming out of nowhere with a random request for something. There's data backing my request, showing safety and efficacy for the concerns that I'm discussing. So that's often my approach. I know that's not a foolproof approach. Some people are still just too afraid of hormones and want nothing to do with it. But to your point, guidelines are being revised, discussions are being had. So hopefully it'll be easier and easier for folks to get access to these hormones, because I recently requested this from my doctor and did get it with no issues whatsoever. It made such a difference.
Yeah.
Such a difference. I was like, why did I wait so long to ask for this? I mean, I know doctors are not going to bring it up, but it's a game changer for me. I couldn't believe it. So
And for the safety piece of it, there is no data showing harm and all the data showing benefit. Again, we give birth control pills, which are giant amounts of hormones for the whole
mhm,
body. This is like using a topical, like perfect, a topical hydrocortisone cream, which wouldn't touch your lichen, right? A little topical hydrocortisone cream compared to prednisone in your whole body, right?
right.
It's totally different. They're both steroids, but you're
Mhm.
talking a little hydrocortisone cream for a bug bite versus prednisone for your whole body. Those are both
Yeah.
steroids, very different sort of effects. So using a little topical estrogen locally, that's a very small low dose, doesn't have the effects of taking a birth control pill style large amounts of hormones. So again, we have to get the education going to both doctors and patients,
Mhm.
because it's a huge problem of by not doing vaginal hormones, you're harming yourself. You're increasing your risk of pain, burning, and when your lichen is not better with steroids, my money's always on you're not being hormonally optimized. And that's, again, when you can't get control of the lichen, lasers aren't going to get you out of this hole.
Mhm.
Hormones will.
Yeah, and that's really interesting that you say that, because often what you hear is my symptoms are flaring, they're suddenly worse, I'm burning, I'm itching way more than I usually do. And the instinct that a lot of patients have is I need to increase the dose of my steroid. And if you go see your healthcare provider, they're going to have a similar thought.
Mhm.
Oh, the
Exactly.
burning, because often they see lichen sclerosus on the chart. So anything that you come in vulvar related symptom wise, they're going to chalk that up to LS, which is going to result in an increasing of the frequency at which you're using your topical corticosteroid, and you're still not getting better. And they say, just use more. And it's really frustrating, probably
And
for both patient and provider.
And here's another explanation. The more steroid you use, the more you thin everything out. Vaginal
Mm,
hormones are there to plump everything up and keep it strong and healthy. So that way the steroid can just work on the inflammation. And so it is the preventative strategy to keep your tissue pink and lubricated and healthy and acidic and strong and fight urinary tract infections. And then you use the steroid to calm down the lichen. And so I would argue, and no one listens to me, but I would argue that everybody with lichen sclerosus must and should be offered, educated, and provided vaginal hormones to
mm,
support the genital and urinary system while we are trying to decrease the inflammation with the lichen. And if you are only on steroids, you are being only given half of the proper therapy. That is my opinion. I feel very strongly about it, and I would happily go in a duel with anybody to sort of argue these little points.
no, that's fantastic. Thank you. So we were talking, I think when you were talking about signs and symptoms, architectural changes came up, which is basically just any change to the physical appearance of your vulva. Sometimes that's fusing, where two parts will kind of stick together. Now, a concern that a lot of people have when they learn about lichen sclerosus and they learn about fusing is, oh shit, can my urethral opening fuse over such that I won't be able to pee anymore? So can you maybe speak a little bit more on urethral fusing and how common that is, either from a literature perspective or in your practice? How often do you see it kind of fusing over? Is it more of a partial fusing? What's going on there?
It's really interesting, and I don't know that I can speak numbers. We can see sometimes the adhering of the labia sort of over the urethra, and we can see some
Mm.
scarring of that way, and that can happen, which makes it difficult to get the urine out. I have not seen many cases, and again, I'm not a huge lichen center, but I haven't seen many cases where the urethral opening gets narrowed, or scar tissue, or a urethral stricture is what we call it, which
Mhm.
I actually find extremely fascinating because you can see it in men more commonly. And
Right.
I actually think that there is a world, and maybe your research can help me prove this, because I actually think that that knowledge gap between what we know about men and what we know about women, we need more people in that space, because I
Yes.
actually think we could learn a lot from that, because the where the skin and the urethral tissue come together in men is very close. They don't
Mhm.
have a vulva. I think the vulvar vestibule could be protecting women from that urethral narrowing because
Fascinating.
there's a lot more space there. I just thought of this right now as we're talking about it. And I think it's so fascinating because we see urethral opening closures in men and strictures in men.
Yes.
But I don't know, maybe you can tell me, because you know the community better than I do. Do we see that very often in women? Because I certainly don't.
No.
And
No, but
so
it's a big concern because they hear fusing is possible, and even though many people don't actually have that happen, we can move into that catastrophic thinking space where it's just like, if this tissue can fuse, why can't this tissue fuse?
I would
And
have
then, of
to,
course, we wanna be able to pee.
I'd have to dive into some of my colleagues here, but I really think there's actually a research to be done there, because I don't
Mhm.
think it happens very often. Now, fusing of the clitoral hood can happen commonly, and that's something we treat and we
Yes.
regularly take care of, and is game changing for our patients for orgasm, arousal, satisfaction, and really protecting the clitoris is really, really important a piece of this. But I certainly do not see many urethral strictures from lichen sclerosus, and that's one, I think, benefit if comparing women to men there, which we don't get many, so we got to take them where we can.
Yeah, no, that's really good to know, and I think that's gonna be very reassuring for a lot of people because, again, that's a big fear for people when they get diagnosed, thinking that I might not be able to pee. Obviously, that's a medical emergency and not something that we want happening to our bodies. But yeah, what I do hear more commonly is that the labia will kind of fuse midline, kind of in line with the clitoris, fuse together, which can partially cover. But in terms of like the urethral opening itself fusing and narrowing, I've not seen or heard or read about many of those cases, but because so many people were concerned, I was curious how common that was in your practice. And I think the question between the, you know, what's going on in penises, what's going on in the vulva, and why are we seeing more stricture here and less here? I think that question is
Does
fascinating.
your group work much with men with lichen sclerosus?
Not so much at this juncture, but we're hoping to change that. Yeah,
I would
we're
love
hoping
to
to get.
I would love to
Mm.
connect you to some of my colleagues, male colleagues in the space who do the research on men, because I actually think if we put people in a room together who study male lichen sclerosus and the women, the people who study female lichen sclerosus, I bet you we could extend our knowledge get for both sides by 10 years with one half day
Mm.
sit down. I bet you I think it would be so fascinating.
I agree. I agree. And please do connect me up with those people because we are trying to get some experts in that can speak to that. Because again, the research isn't nearly as stacked as we have on vulvar lichen sclerosus. It's a bit harder to find information supporting men with the condition. And then same for the support groups. They're almost non-existent. There's maybe, I think, one on Facebook, but from what I hear, there's not a lot of engagement. But we're still getting questions from people, and we want to have accurate, evidence-based information to give them so that we can, provide better support. So we're hoping that that's going to change too. So one thing. So because it's not common, I think I kind of know where this is going, but a lot of people get concerned, people with vulvas anyways, concerned about the stream of urine. So a lot of people with lichen sclerosus, vulvar lichen sclerosus, will say when I pee, the stream isn't straight. It kind of sprays all over the place. And the thought is that, oh, if it's spraying, then I maybe have like a partially fused urethral opening. Is that what's going on? Or is it maybe in some people, because this happens to me, right? I don't pee straight. It pee kind of goes everywhere. But I attribute that to the loss of the labia minora and things being kind of more flat. So I don't have this labia minora to kind of guide, I guess, the urine stream down. So if people do have that kind of not so clean stream of urine, is that, a sign that something is going wrong with the urethral opening or the urethra proper? Should they be concerned? What's going on there?
It's so fascinating. You literally, this talk has given my brain, it's making my brain explode, because urethral spraying is something that plagues urologists in the way of, like, we don't know why and when it happens, why it happens, when to worry about it, when it's a real problem.
Right.
And and I would have to do a dig. Luckily, I have a group of hundreds of medical students. I'm literally sitting here, like, I have to text and call them and make them. So I don't know if it's been studied, right? The first step of research is what's actually out there and doing a deep dive of what people know. But could you do a study, if it hasn't already been done, of looking at people who have I'm obsessed with labia minora. I'm obsessed with labia minora because science has completely ignored labia minora, and
Sure.
there's no research on labia minora other than people wanting to cut them off for labiaplasties, right? There's a little bit of research, right, with lichen and absorption of the labia minora, but that's about it.
Yeah.
And so we have a group of students sort of really looking at, what do we know about the labia minora? Why do they shrivel up and disappear? How do you make them grow back? Or do they serve a purpose? And what you just said about the spraying of the stream and the labia minora being a guidepost of straighter streams, could you do a study with people urinating with their labia, like in different size labia minora? And is there a difference of the spray and the trajectory and the physics behind what's happening? Again, depending if they pee with opening their labia, to pee, is that a different stream than if their labia are closed? And at different points of the life cycle, it's fascinating. And you just completely probably forced research projects that I wasn't even thinking about.
Well, I'm very grateful for that, because I think what's interesting is that when it comes to the topic of surgery and lichen sclerosus, what I've often been told is that surgery is only considered if there's a functional issue, for lichen sclerosus anyway. So we can perform surgery on the clitoris because if it's phimosed and it's fused, you can get, infections, pain, all of these things, decreased loss of sensation. If you have narrowing of the vagina and there's scar tissue there, that poses a functional issue. It's harder to insert speculums, tampons, penises, etc. That's considered functional. But I'm always told, we don't do surgery on the labia minora, either to unfuse or recreate, because the labia minora serves no functional issue. And that's what I've always been told.
Right. Well,
exactly. And so when you're talking, I'm like,
that's because we don't know anything about the labia minora, nor do we know how to stop the fusion, right? And this is where my brain says, so you lose labia minora regardless of if you have lichen sclerosus, right?
True.
Menopausal women resorb their labia minora. So theoretically, right, there should be some hormonal piece, lack of estrogen, lack of testosterone, something that's happening that causes it. So the question becomes, can you prevent it from resorbing, and can you grow it back? I don't know that there's enough research. That's kind of where my interests lie. And to your point is how can we get at this before the problems happen? But we have even more of a problem because we have many people who don't develop labia minora because they have lichen as kids. And then I don't know enough if there's any research on the development of labia minora. Is it happening when in puberty? Is it happening? To what degree is it happening? Is it happening with estrogen? Is it happening with testosterone? Has anyone looked at it? We give a lot of young women birth control pills. Does that blunt the ability for that to grow? If you have lichen sclerosus as a kid, but it's treated, do the labia still grow? If you have lichen sclerosus as a kid and it's not treated, do the labia never grow? These are things, again, because we call them private parts and no one wants to ask the questions, and we're still on like, pain down there, or vulvovaginitis for these little girls. We are 30 years behind figuring this out. Because I will tell you, I have to beg my pediatrician to look at my kids' genitals, right? Like the pediatricians are not looking because they don't want to get thinking that they're abusing children, which is, again, can you imagine them not looking inside your kids' ears? Like the genitals are body parts that can have problems that can arise. And if no one puts eyeballs on it, we're missing it. It is labia minora are so fascinating, and science has completely ignored them. If a penis shriveled up and disappeared, we would be studying it. There would be vaccines. Pfizer would be, talking about it, right?
Yeah. But that's it. But we're just told like, well, it's fine. They don't serve a purpose. So we just have to, do the emotional, mental healing to kind of just accept that they're gone. But that's what we're told time and time again. Don't worry about it. They don't do anything. Worry about your clitoris. That does something, which
Not
yes,
only do
it
we
does.
not know, so not only do we not know if they don't do anything, we don't even know the neuroanatomy. We don't even know the nerve endings that innervate the labia minora and
Mhm.
the vulvar vestibule. It literally, there was a paper just recently I reviewed that literally was the first to ever hypothesize what the neuroanatomy is. So we have completely ignored this from
Wow.
even a basic scientific understanding of what receptors are here, what is the tissue made of, what makes it grow, what makes it shrink. Like it is research is wonderful, but if you don't ask the right questions, if nobody's asking the questions and doing the work, it doesn't happen. And
Mhm.
so, how much do we not do because we just don't know?
Yeah.
Versus like what? Oh, that's just what's always been done. We've always told people the labia minora don't do
Mhm.
anything. We've always told people. We've never told people to do clitoral hygiene, so we shouldn't because we never have before. And the question is that true? Is that right?
Mhm. Yeah, 100%. I know you and I are both getting really excited about this now, and I'm very obsessed with the labia minora. I mean, I literally called the Lost Labia Chronicles. I started that after my lost labia, which I was very distressed about. And then I kind of, healed that grief and then made the Lost Labia Chronicles was kind of just a punny way for me to kind of reclaim that lost part of my body. But it's always been a fascinating part of our anatomy that's really captured me. And I can say from a community standpoint, it's a part of our anatomy that many people deeply care about. And it feels very invalidating to be told, oh, don't worry, they don't do anything. It's fine. It's fine. So yeah, hopefully this conversation is going to spark a lot more research into this area. So if people do suspect that there is some urethral stricture, that there may be some urethral problems that may be relating to vulvar lichen sclerosus, what would you recommend they do? Should they book an appointment with their healthcare provider? What kind of healthcare provider should they be seeing? And what are the kind of options? So let's say there is some fusing. Is it surgery? What are people looking at?
Yeah, so urethral strictures, you're going to want to see a urologist, and you're going to want to see a urologist who knows about urethral strictures, which is not every urologist necessarily.
Ah, okay.
So the thing is working with someone, we often call them reconstructive urologists, or
Mhm.
that really look at this carefully. Again, you're going to want an exam. They may want to do a telescope, what's called a cystoscopy, to take a tiny telescope to put it into the urethra and into the bladder to look around. You're always encouraged, if you need anesthesia or extra sedation, please fight for that, because
Mhm.
we do these in the office, and a lot of people who have very sensitive, tender tissue, it's not a pleasant experience. And so you do want to be able to advocate for yourself loudly. But again, they can look at the narrowing. If they can't get a telescope in there, then they may want to take you to the operating room to do either a stretching procedure where they stretch it open. There are more advanced surgeries for urethral strictures, but again, you would always want to work with someone who is what we call a reconstructive urologist, who's going to really look at this carefully. Interestingly enough, I was talking a lot about the inside of the cheek. They use that tissue sometimes to help rebuild a urethra when it is scarred down, both in men and women. And so there's some really interesting techniques that can be used to help with urethral strictures and scar tissue.
Wow, that's fascinating. I didn't even know reconstructive urology was a thing. And is this is similar, I would assume, for men as well?
Absolutely, they do it.
Yeah.
They for sure. Now, some female urologists have sort of that training as well. For urethral strictures. So again, you may have to seek expert level care. So you may not have someone in your local town who
Mhm.
does this kind of thing, and so you being dismissed is a them problem, not a you problem, unfortunately.
Yeah, 100%. When it comes to overall urethral health, do you have any recommendations for the LS community? Is there something we should be doing? Is vaginal estrogen a part of that? Is there any other things that we can be doing to keep our urethra good and healthy?
Yeah, vaginal estrogen or vaginal DHEA are probably the most important things you can put into your body as you get older. Think of it like sunscreen, like wearing a seatbelt,
Mhm.
like putting moisturizer on your face, prevention, protection, wearing sunglasses to protect your eyes. Vaginal hormones like keep the tissue strong and healthy. It creates a healthy a microbiome. It creates lubrication, so that you think of putting oil in your car, or greasing the wheels, or for your brakes. Like you need a lubrication to help everything work better. You need acidity to fight infection and bad
Mm.
bacteria. You need a lack of inflammation, and when things are dry and cracked and irritated, they get inflamed. Sex, if it's something you want to have, penetration, it's a contact sport, and if the tissue is thin and raw and irritated, it's going to thin, crack, raw, bleed,
Yeah.
inflame, irritate, and the muscles underneath are going to be unhappy. So vaginal hormones is a must, whether you have lichen sclerosus or not. It prevents urinary tract infections by more than half. It comes in different forms. That can be a cream that you put a gram in their vagina every day for 2 weeks, and then twice a week till death do you part. It can be a tablet insert that you can put in the vagina. You can do the tablet insert in the vagina every day for 2 weeks, and then twice a week till death do you part. And you can put a cream on the outside labia every day if you wanted to. You could do a vaginal DHEA suppository, which goes in the vagina every single night till death do you part. You could do a vaginal ring that gives local estrogen to the vagina that stays in the vagina for 3 months at a time. So there are options for vaginal hormones, and they are so fundamental, in my opinion. It is the fundamental treatment for lichen sclerosus. It is just as important, in my opinion, as clobetasol, which is extremely important to use clobetasol correctly, of course. So
Mhm.
again, what's so interesting, Jackie, is that, like Jacqueline, is that it's not hard, it's not complex, it's not
Right.
challenging, and yet so many people aren't doing it, aren't being offered on it, or having to beg their clinicians to give it to them, right? And so what I do is not brain surgery, it's not complex, and yet it makes a huge difference, right, in architecture preservation, in urinary tract infection prevention, in intimacy, in itching reduction. I mean, these are huge, huge things. And as we all know, lichen sclerosus untreated can lead to vulvar cancers. Why? Because
Mhm.
you have inflammation, and inflammation creates cell turnover, which can lead to cancer. And so even more of a reason why vaginal hormones are so, so necessary to decrease all of that inflammation as well.
Amazing. Thank you so much for that. Quick follow up, because you said something about, the microbiome and the acidity. So a lot of people use emollients alongside their clobetasol or whichever steroid they're using to just kind of help protect and soothe the vulvar skin. Do people, or would putting it in the vestibule be recommended, or would that kind of disrupt this acidic environment that we're trying to foster?
So I would say the order of importance would be hormones regularly, which take about 2 to 3 months to maximally work. So don't take it, use it for a month and say, oh, it's not working for me. It
Yeah.
didn't work. If it burns or feels bad, use a different form. Like there's different
Mhm.
kinds. So fundamentally, you have to create a good, healthy hormonal environment, and that has to continue. I've got people with lichen who said, wow, it burned for the first month and then I got better and now I'm amazing, right? So you sometimes
Mhm.
have to get through it. Now that's where emollients can really be helpful. So if you use these hormones and the clobetasol and it's burning, then you put sort of aquaphor
Yeah.
on top of it to really help with some of that burning. Can be really useful. So you got to work with your clinician who can tinker this with you and hold your
Mhm.
hand along the way. But sometimes think of a sunburn. When you have a horrible sunburn and you're trying to put aloe on it, it hurts, it burns, it feels
Yeah.
badly, but you know the aloe is going to be soothing. And so vaginal hormones, like just using aquaphor on it is not going to fix the sunburn. But if you use something that's going to fix the sunburn, it's going to hurt when you
Mhm.
put it on. And so sometimes you got to get over that hump to heal the tissue. And it's the steroid and the hormone that's going to heal the tissue. And then the aquaphor that's going to soothe and be a band-aid. But please don't just use band-aids. Like just
Right.
using band-aids is just going to keep you miserable.
Yeah, 100%. Okay, well, thank you so much for all of this information. Is there anything that you wanted to mention in this topic that we didn't get a chance to say before we kind of close out?
Just that I'm so grateful of all of the work that you are doing. It is patient advocates that change the whole world, that make us research better, that make us answer questions better, that make us better doctors. We have so much work to do in women's health, and we need your voices. We need you loud. We need you advocating. And I'm so grateful for you putting all of this out there and giving people a place to learn more, because 10 minutes once a year with your legs up in stirrups is not healthcare. It's not acceptable. And if you're getting that, that's all you're getting. That is a medical problem, not a you problem. Like, that is not acceptable for anyone. And so I would love for people to follow along. They can join our newsletter at rachelrubinmd.com and follow us. We're in the Washington, D.C. area, and we would love for people to come to our practice. We're growing. I'm training people at the highest level, because what it takes is time with you to get to know your story and know how we can help you specifically. And then please feel free to follow me on social media. All my channels are at Dr. Rachel Rubin. You can see that at the bottom there, which is just magical that you did this. And just very grateful.
Awesome. Well, thank you so much. This has been such a great conversation. I'm so, the gratitude extends right back to you, because it does. It takes a team. It's a team of us. It's healthcare providers. It's patient advocates. It's caregivers. It's everyone working together to change the landscape of genital pelvic pain, vulvar conditions, and all of that. So thank you again so much, Dr. Rubin. Thank you to everyone for watching. That's it for this video. We will catch you in the next one. Bye.